Hello, good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT, Technical and Medical Campus, Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll discuss about the hip joint anatomy. So first is the definition. So hip joint forms the connection between the lower limb and the pelvic girdle. It is a synovial articulation between the head of the femur and the acetabulum of the pelvic bone. The joint is a multi-axial ball and socket joint designed for stability and weight bearing at the expense of mobility. Next is the articulation. So the articular surface of the hip joint are the spherical head of the femur and the lunar surface of the acetabulum of the pelvic bone. The lunate surface is covered by hyaline cartilage and is broadest superiorly. Except for the fovea, the head of the femur is also covered by hyaline cartilage. So the rim of acetabulum is raised slightly by a fibrocartilaginous collar, that is the acetabular labrum. Inferiorly, the labrum bridges across the acetabular notch as the transverse acetabular ligament and converts the notch into a foramen. Next is the diagram of the articular surface. So it is formed by the acetabulum of the pelvic bone, that is hip bone, and the head of femur and the acetabulum labrum. Next is the capsule. So capsule is attached to the hip joint is a strong loose fibrous capsule which permits free movement at the hip joint. It attaches proximal to the acetabulum and transverse acetabular ligament. Some part of the fibrous capsule are thicker than others and are called ligaments, the iliofemoral ligament. Next are the ligament of the hip joint. So hip joint is further strengthened by the presence of strong ligament. So the ligament of the hip joint include iliofemoral, ischiofemoral, pubofemoral, and the transverse acetabular ligament, that is a ligament of the head of femur.